I encourage you to use your learning guide and follow along. Vignette number 1 talks about Sara Bonillas, a college freshman whose heart is at home and not in the academics. Let me tell you a little bit about Sarah. Sara is a college freshman at an Eastern Ivy League college. Of Mexican-American heritage, she's originally from Tucson, Arizona, where she was class valedictorian. She had many college scholarship offers, but decided to attend an all-women's institution, much to the approval of her parents. Sara is the oldest daughter of 6 children. She did very well her first semester, earning a 3.5 grade point average. She is now back from winter break. Sara was referred by the Student Health Center. She went there complaining about headaches, tiredness, and a lack of interest in her studies. In fact, she reported that her grades were beginning to drop. She had failed a few of her preliminary quizzes. So she had some concerns, but she also wasn't feeling good. Not finding any physical explanation for these symptoms, the physician referred Sara to Dr. Casas, the part-time counselor at the College Counseling Center. Let's watch their interaction now.
Hello, Sarah.
Hi.
How are you doing?
All right, thanks.
Good to see you.
Thank you. Just feel kind of a little weird here.
Okay, a little weird.
Yeah.
I understand Dr. Keith referred you to me.
Yeah, I just haven't been feeling well. I've had headaches and I haven't been able to eat, so and we don't know what it is. So I went to him and he kind of recommended I speak to you.
Uh-huh.
Yeah.
Tell me a little bit about what has been going on. You haven't been eating, you have headaches?
It was kind of strange talking to a stranger about my problems.
Yeah,
But,
yeah.
Yeah.
Well, do your best.
Okay. I just kind of been coming to school and everything, and it just ever since I got back from home.
Where's home?
Tucson?
Tucson.
Yeah.
Oh, far away from here.
Yeah, I'm really far away from home. Okay. So, and ever since I got back, I just haven't been, I don't know, I just don't feel the same way like I did last semester.
Last semester was your first semester
Yeah.
here.
Mm-hmm.
How did you do?
I did well. I did really well, and it was exciting and something brand new and everything. And I met a lot of people, but this semester, you know, the same old thing, and I don't know, it's not that exciting anymore, and I miss home a lot.
You do?
Yeah.
Okay. Did you go home on vacation?
Yeah, I did. I was home for Christmas, and I got to see my mom and my brothers and sisters, so that was great. That was really good. So,
when did you get back?
I got back in January. So I got back, so I've been
about a month and a half ago or so?
A month and a half ago.
Okay. And when have you been noticing the symptoms?
I don't know, the past couple of weeks.
Couple of weeks.
I don't know.
I see.
I just wasn't the same after I got back from home.
Really?
So I just haven't been feeling the same way.
In what ways it wasn't the same?
I don't know. I keep thinking that maybe I should go back home. I mean, I don't know why I'm here.
You miss it?
I miss home a lot, and I could do just as well going to school in Arizona than going to school here.
I see.
And I'm like, my family needs me, and I know they need me, so it'll be kind of good if I was back home.
How do they need you?
How do they need me?
Yeah.
I mean, God, I'm the first one to go away to school. I'm the oldest, so my mother. It was hard for me to come here in the first place. So
to go away to college.
Go away to college.
I see.
Yeah. No one in my family had gone away to college beforehand.
Wow.
And so it was kind of big.
Your parents actually let you go, huh?
Well, it was hard at first, but they supported me to a certain extent. But I know it's hard on my mom, you know, having your kids say, like I was always home helping her. And
you're the oldest.
Yeah, so I was the oldest. So, and my dad's never home. He's always working, so it's kind of, you know, I know I miss my mom. I know she misses me.
In what ways do you miss your mom?
I just
being around her or helping her out? I mean,
just being there. I don't feel like I'm part of the family, being all the way over here.
I see.
And I just feel really separated from them. When I went back home, I just saw how my younger brother had kind of grown, and I kind of missed that. I mean, he started first grade, and he's the youngest of the family.
I see. How many brothers and sisters do you have?
I'm the oldest of 6.
Oh, wow.
So I have 5 younger brothers and sisters.
Did you feel that by you being away from home that somehow your parents were forgetting about you? Oh
No.
or that you no longer were important, or how?
I know I know that I'm important in my family,
Yeah.
but I just think that, I don't know why being here. At first I thought, going away to school, I get the best opportunities, and this is this way I could help my family when I graduate, etc. But I keep thinking about it. Maybe I'm not really helping them being here right now.
Mm-hmm.
I keep going back and forth. I don't know. Maybe this is why I have had like all these headaches and everything. I keep thinking about this stuff.
And that in one hand you want to continue on with your education because in the long run it's going to be helpful for your family. But on the other hand, right now you want to be there because practically you will be helping your mom.
Yeah.
Wow. So you've been doing this back and forth.
Yeah, maybe that's why. Yeah, maybe
that's why you have
is right.
Yeah.
But
Did he say something about the reason why you have a headache? Or?
I didn't know why. Maybe I knew. I just felt weird coming to you, and I don't know, like my family, we usually don't go and see counselors, so it's kind of different.
Does your family know that you're coming to see me today?
No.
No.
No, they don't.
We are now ready to debrief this first role play. For each vignette you will see, there will be an opportunity to pause and do this kind of dialogue in your class. You have 5 questions on your study guide that I encourage you to follow. In this particular debriefing, I'm going to ask 2 participants to stay in their role as counselor and client. And I will ask them a couple of questions that will help us understand how it was to be in that role. 2 Latinas working together, if you would. Dr. Casas, the therapist who is of Latina heritage, and Sara, the client of Mexican American heritage. Let me start by asking Sara, at what point did you find that Dr. Casas made a connection to you?
I think right in the beginning when I said I was really nervous about being there, she goes, yeah, I understand how you feel. And I think that maybe made me a little bit more comfortable to know that she understood how I felt nervous being there talking to a stranger.
At what point did you think she connected to you as a woman of Mexican American heritage? What might she have said that gave you a sense that she understood and knew that?
Oh God, I can't think of anything right now off the head. I think one of the things she could have said was, just by looking at her, I knew she was Latina. So that made me more comfortable, just knowing that she was Latina, being there. God, I can't remember anything specific.
But Nancy, I think you're mentioning something that's important, that sense of knowing.
Yes.
Just by looking at another person, if you are from similar cultural background.
Yes. Okay, just being there.
Dr. Casas, what were the cultural issues you heard in Sara's story?
Actually, 2 that came up, and that tends to come up a lot, and that is the conflict that students tend to have, even though they might be excellent students, of having to fulfill their own needs and pursue their own goals, and also meet their family's needs. And that issue tends to happen a lot. Being responsible for the family at the moment, at the present time, and at the same time also feeling responsible to fulfill their needs and their future goals that are going to be obviously part of the family's responsibility and the responsibility to the family.
We heard in Sara's story some of the loyalty towards family, some of what we call as a value allocentrism, you know, the sense of interdependency and relationship, value of relationship that goes beyond oneself. Was Dr. Casas, was Sara's story been different if she were a male freshman?
Somewhat, yes. And the reason is that it would not, even though it might be a little different, mainly because of him being a male, would not be so concerned about helping mom. It would be perhaps being with the family as a family member, but not so much as helping the mom and being responsible to fulfill that need. So,
is there something else that you would observe, Sara, that coming from your cultural background and being in college was important for a counselor to understand about you?
I think just from the beginning, when she said she wasn't comfortable being there, that's really important, I think, because my understanding is like a lot of times you don't expose your family problems or your issues to strangers. So that's something kind of like loyalty to the family, that you don't talk to other people about your issues. So I think that's something that you should be conscious about.
Mm-hmm. For a
things.
counselor to need to be conscious of that for a Latina coming into the counseling center.
And also the attachment to the family and the connection and the importance of that. That's really important, of being part of the family.
And we know that in Latino culture, the family is really core to one's identity and to, again, the meaning one makes in life quite often. What I'd like now to do is ask Dr. Casas, you want to comment again?
Yeah, the comment that I wanted to make was when Sarah was talking about feeling in some way disloyal to the family, that she was in some ways embarking in a new world and enjoying it, and also feeling probably a little bit guilty that she was coming to talk about the family and the family didn't know about it.
That's not unusual, is it, to have that sense of guilt? You really, again, want to share your burden or release your burden, but on the other hand, it may feel like there's some disloyalty going on by doing that. We're going to move to just highlight some of the learning points that have come from this first vignette and encourage you to turn to your study guide. The first learning point to keep in mind that Latino culture is primarily allocentric. It means that concerns for others are part of one's normative way of seeing relationships, and I stress the word normative. Second, that Latinas, especially the oldest daughter, are socialized to be mother's right hand. They assume many caretaking responsibilities. Third, women typically remain at home before marrying. This expectation persists even with second and third generation families. Fourth, in Latino culture, one does not air problems with strangers, as we've heard. And fifth, Latino culture stresses family loyalty and interdependence versus individualism, particularly for women. And again, I encourage you to dialogue about this in your class, keeping in mind some of the Eurocentric models that we've all learned, and to see where there may be points of conflict with some of the Latino cultural values and models. Vignette number 2 features a young couple, a young professional couple. Sofia Arabello and Raul de la Cruz have been experiencing stress due to Raul's unemployment. His wife Sofia is feeling the brunt of the workload. She's needing to work excessive hours and put off her professional plans. Let's give you a little background about Sofia and Raul. They met at college and have been married for 2 years. Both came to the United States during high school from Colombia and the Dominican Republic, respectively. They started dating while in college and married 2 years after graduation. Sofia is a psychiatric nurse. Raul recently completed his MBA with a specialization in financial operations. He's been looking for the right job, knowing that as a Latino, he is really a rarity in the field, so he's trying to hold out for the right job. Sofia persuaded Raul to go to see the counselor because she has refused to continue to work overtime. He claims that she needs to trust him, tener confianza, that he will take care of her as soon as the right job is offered him. The therapist, Dr. Casas, who they will visit, is also of Colombian heritage.
Buenas tardes,
Buenas
Sofía. ¿Cómo
tardes.
está?
Bien.
Raúl, ¿cómo le va?
Mucho gusto.
Sophia, you made the appointment to come today. Can you tell me a little bit about what's going on?
Sure. Took a long time for him to come. I trying to convince him to come.
Uh-huh.
I'm very happy he did.
Good.
He has been without a job for a long time. At least he hasn't been able to find the one that he wants.
Mm-hmm.
I've been working in the hospital weekends and nights, and I'm just very tired of working.
Mm-hmm.
I haven't been able to go back to school because, first of all, we don't have the money, and I don't have the time.
You're working, obviously.
Yes.
I see. So
we've been arguing a lot.
Mm-hmm. So it's really interfering in your relationship.
Very much so. Yeah.
I see.
Well, yes, but what I'd like Sophia to understand is that this is very temporary, and that once I find the job that I'm looking for, and it's enough for me to be able to support her the way that I want to, and the way that I'm intending to, so that she will be able to go to school, and if she wants to take some time off, she'll be able to do that.
So you see it as a temporary
Yes, absolutely.
issue.
And
how long has this been going on now? In looking for a job?
7 months now.
About 7 months. Okay.
It's been
And you
7
think it's too
months.
long?
It's been
Yeah.
7 months since I've been working weekends and holidays and
Wow. Must be
overtime.
tired.
Very tired and very stressful.
And
It's also embarrassing, I think.
embarrassing.
Yes, very much so.
Tell me more.
My family's always asking me, how is Raul doing? Did he find a job? I have no answer.
You don't know what to say?
No, I don't know what to say.
I had a long talk with her father the other day, and they know when I talk to her father, and he and I understand what's going on. He understands that I'm really trying to get the job, and
But
you
my
know,
Lord, I need you to take care of me.
and I will, and that's precisely what I'm trying to do. But I think that if we talked about this at home a little bit more, and I think that we can resolve this, and it's only temporary, and we'll be fine.
We talked about this at home a lot. That's
Yeah.
why we
But you don't
came
resolve
here.
anything, is that what
right,
you're saying?
so that's why
see.
I called you.
Okay, all right. Hoping that this will be cleared
Yes.
up. Okay, do you understand what your wife is saying, Raul? Do you know what her concern is?
Well, I understand, but if she could be just a little more patient, I think that it would be great. And
What
once
would you like her to do? What is it? In what way? And what ways do you want her to be a little bit more patient?
Well, for one thing, I think that just trusting me and knowing that I'm there to take care of her, and that once I get my career going, I will be able to take care of my family as I have vowed
Take
to
care
do.
of her.
Of course.
Why don't you get a job that just
What's
makes
preventing you
money?
from getting a job, or from taking care of her, from doing what you would like, or what she would like you to do?
Well, I mean, it's just the matter that I've gotten a couple of job offers, but I really would like a job that will allow her to go to school and to or stay home if she'd like for a while, and all of that. So I want that right job, basically.
You want the right job.
Right. Yes.
Oh, and
That really upset me when you
Yeah?
said that.
And right now,
Because we need the money right now,
uh-huh.
and he's just looking for the job that makes $1 million, you know. And,
Oh, I see.
and not
Is that the
necessarily.
right job for you, that you want to be able to do?
Well, I want to earn enough to provide
I
for
see.
my family,
I see.
and that's what I'd like to do.
I see. But
I think that, I mean, that's how I was brought up, and I don't see that there's nothing wrong with that.
Halima, maybe you can get a temporary job until you get the one that you really want. Just for a few months, you know, and I just want to take a break. I'm tired of all this, and also arguing every day.
Well, you see, before we didn't argue when we first got married. Lately, I just don't know what's going on. It's like,
you don't understand that she's upset and she's tired and she's not happy with this situation?
I mean, she's become very Americanized, I think, in terms of, because she's working and I'm not, and now she's raising her voice at me and at her father the other day. So, lately it's been a little more...
this is unusual.
Of course, yes.
And why do you think that she's doing that?
Well, I think that because she's the one working, and maybe because she's making more friends at work, and it's just taking on a different persona than who she
Raul,
was.
it's not only that, honey. It's my health. I mean, I've been working so hard. I've been losing weight. And I also want to go back to college. I want to get my master's. And that's something that I really want to do now.
We're now going to begin the debriefing of vignette number 2. I'd like to make a couple of observations before we talk to the participants. One is you will notice the seeming comfort that they all shared once Dr. Casa opened the dialogue in Spanish, and they responded accordingly. This was a signal that it was acceptable to communicate bilingually. The second point that you might have noticed was the communication between the couple and how there were some references or some language in Spanish that both, again, individuals shared, and again, it was a common denominator for the group. I'd like now to talk to our participants and ask for your feedback on the role you played. Let's begin with Raul. You mentioned, or actually Sophia mentioned, that she had really tried to bring you in and you had finally agreed to come into this counseling session. Can you tell us what it was about coming to counseling for you that was an issue?
Sure. I think that is a little bit difficult. I mean, because I know the culture here and everything, I understand that going to a counselor is not a major disaster, but to a lot of the people that I know, especially the ones with maybe a lower degree of education, I mean, you only go to see a psychiatrist when you really have deep psychological problems. And so it was a little difficult for me in terms of my issue. It's finding a job and not really that we have problems.
So there's a stigma attached with going for help
Yes.
To a psychologist or to a counselor, as you say.
Yes.
Sophia, how was it for you to come to a counseling session and admit that you were having problems in your marriage?
Well, it was a little embarrassing, but I know that maybe a third person can help us. I really want our marriage to work out. But at the same time, Latino women are not used to support the family. It's the man who is the one who supports the family. In this case, it's not. I'm the one who is supporting both of us.
And that's very different from how you were brought up
yeah.
and the example from your parents,
Yes.
apparently. Dr. Casas, what cultural issues did you pick up as we role play here?
Well, both, particularly the gender issues and family responsibility that I think Sophia just pointed to, and that is that in the Latino cultures, it's the man who takes on the role of supporting the family, and here we switch where she is the breadwinner, and not only with one job, but two jobs, which makes her feel, on the one hand, empowered, and I think that was what's going on with Raul. He was picking up on the sense of empowerment for her, but on the other hand, the burden, not only the physical the physical part of aspect of the job, but also the embarrassment for the family that she's doing something that is culturally not perceived as correct.
Mm-hmm. There's a word in Spanish that I know we're all familiar with, it, and the word is vergüenza, or shame. Was any of that operating for either of you in this particular counseling session?
Well, in coming here, you know, obviously we didn't discuss it with the members of my family and her parents or anything. So, because, you know, we didn't want to let everybody know that we're coming.
I think Raul feels a little vergüenza of coming here because of his machismo role in the society. And I think I'm right when I tell you that you're a little macho, and that's what society and all culture say so.
That's the expectation, in other words.
Yeah.
Dr. Casas, in this particular scenario with this couple, was there, what were the strengths that you saw between them? I mean, clearly they came in with presenting a problem. But what were the strengths?
The biggest strengths were the fact that she was able to convince him to come to therapy. I think that she was obviously a very influential person in this relationship, and he obviously allowed that, and that's wonderful. The fact that they're coming to therapy is obviously a good thing for them.
There are strengths in a relationship, and those strengths oftentimes to a therapist who is not familiar with the Latino culture may lie invisible because they are known to one another. And in Dr. Casas' comments, we heard some of the strengths that she heard between the two participants. Let me just briefly highlight a couple of the learning points. We talked about in the debriefing about the machismo and how that means that the man wants to be the breadwinner for the family, wants to take care of his family. The other issue that we didn't have a chance to really debrief was that factor of Americanization that Raul referred to, talking about Sophia about being more Americanized. We know that acculturation is a factor within couples, within families, and it's a variable that needs to be understood by a counselor, because we may set expectations based on the acculturation of one individual over another. A third point that I want to make sure we highlight is that of family. There are family pressures on a couple, and these family pressures can induce guilt, shame, and embarrassment. There are expectations, there are norms individuals have to live up to in terms of the family's eyes. And a very strong Latino cultural value is what we call orgullo, or pride. And for both Raul and for Sofia, orgullo was very important to them and to their families. This is vignette number 3, and we have a work situation that we're going to role play for you. Gloria is the manager of a management information system, and she finds she is hitting the glass ceiling. Let's tell you a little bit about Gloria's situation. She's been working for USA Insurers for the past 6 years. During this time, she has had 2 promotions, one that was a definite advancement with an increase in salary, and the second that was more of a lateral move. She has consistently received excellent evaluations, indicating that she is qualified for a promotion. Gloria is bilingual, enabling her to communicate with vendors from Spanish-speaking countries. This is not part of her job description, but she does it willingly whenever a request is made. Each time she approaches her boss, Hank, he tells her to be patient. He knows she wants a promotion, but he tells her she is doing a good job and that she needs to wait for the appropriate position, not just any position. Gloria is beginning to wonder if her boss is being honest with her. She has seen newcomers, people who came after her, promoted. All of them are white. Hank is a nice man to work with. So Gloria wonders if she's being too pushy or is she really not qualified. Let's hear her talk about her dilemma in this next role play.
Hi, Gloria. I'm Dr. Mann.
Nice to meet you,
Nice
Dr.
to
Mann.
see you. What brings you here today?
Let's see. I would like to get something off my chest.
Absolutely. Absolutely.
I'm here because I need to talk to someone, and my first choice would have been a Latina or a Latino therapist, but that wasn't possible.
Yeah, you sort of ended up with this blonde-haired, blue-eyed person, and what?
Well, I guess that I wanted a Latino because I felt more that they would be more able to understand what I have to say here, but we'll try it and we'll see how it goes.
Yeah, well, tell me what you think about this. Let's give it a shot for this first session, and then we can set aside some time at the end, and if you think it's a match, that's fine, and if it's not, then, you know, maybe I can help you get connected with a Latino or Latina counselor. How does that sound?
Sounds good.
Okay.
Sounds good.
Okay. And by the way, it's good that you're able to sort of get that out of the way.
Thank you.
You're welcome.
Well, as I said when I talked to you over the phone, I'm having a lot of trouble at work, and I think that basically my boss Hank is discriminating against me. I have been at this job for the last 6 years.
That's a long time.
Yeah, and I like the job a lot, and I think I do a great job over there.
What exactly is your job?
I'm a manager at an insurance company, at an MIS department. And
Could I just, is it the same insurance company that said they didn't have any Hispanic counselors available for you?
it's the same one, yes.
I just couldn't reason. Okay, go ahead, I'm sorry.
I have been there for 6 years. I have had 2 promotions. One of them, the first one, was a very good promotion. I was very happy. I thought I was going someplace.
Yeah.
The second one was just a lateral promotion. And since I've been there, I have had very good evaluations every year. I'm very happy. My boss says that he's very happy with my performance. And but when there is time to promote, I don't get the
You don't
promotions.
get the promotion.
I apply for them. I have been working hard because I do want the promotions. I feel that I like my job and I would like to get someplace with it, but
Go ahead, I'm sorry.
I don't get anywhere.
And I assume that you've discussed this with your boss?
Yes,
And
I have.
he says?
He just doesn't get it. I don't think that he gets what's going on. He says that it's not my time yet. That when my job gets when he sees a good job for me, he'll let me know. And I have been just waiting and waiting, and nothing happens.
What do you think the real story is?
Well, I'm in this office. I look very different. I have an accent. I'm even in the end of the hall because I'm not in the place where people walk in and they are able to see me.
So you're sort of out of the mainstream?
Yes, I am at the end of the hallway. And I feel that he doesn't think that I'm able to do my job. And it's all because I have an accent, because I look different, and
So
perhaps I behave in a way that he's...
So even though he says the appropriate position for you hasn't come along, it's in your heart of hearts what you're really believing or thinking is that it's more personal, it's more about you.
It's about how I look, it's about how I act, it's about how I dress.
Have you taken that to him?
Well, he's a nice guy, and I like working for him, and it's not that this is a terrible place to work at. I have been trying to make it clear to him that I want a job promotion, that I need it, and that would be the only way that they can hold me in that position for a while longer. That hasn't worked. So I think that it's time for me either to talk to him directly about it and bring up the issue of how I feel and how I have been discriminated, or I'll have just to look for another job.
So it's either sit down and talk with him or look for a job and find one and then give your resignation?
I guess so. It's not that easy to talk to him. I have been talking to people around the people I work with, and they don't feel that I have anything to worry about. They think that Hank, that's my boss, likes me, and that it's just a matter of not having had the right opportunity.
Did you ever sort of wonder in your heart of hearts how it was he knew what would be the best job for you, as opposed to maybe you being cued in on that?
Well, I think I know what my the type of job that I'm able to do, and those are the jobs that I have.
In vignette number 3, there were some very interesting issues that came up for the client. And I'd like to begin the processing by asking Dr. Mann how it felt to be told by the client that you were not the counselor of choice.
Well, actually, it's fine, because if it hadn't been expressed, there would have been a certain tension in the session, and she might not have been able to really get into what it was that she needed to get into. It makes perfect sense in terms of Gloria wanting, to have someone with the same sort of origins as her. So, and it would be interesting, to sort of take it to the logical conclusion and then ask, would you like me to help you find someone else? Were you comfortable? Because I would assume that since she was honest enough and had, the oomph to start the session that way, that at the end she would be honest enough to say, it's not a match, or yeah, it's fine.
And yet it's possible that another therapist might have felt somewhat offended by her honesty.
Oh, I would imagine so. Yeah, but you don't personalize those kinds of things. It's an issue, and you have to deal with it. But and you take it from there. And it's certainly any client who can do that. It's certainly to their credit.
Okay, and so it's an important distinction, because sometimes we're not that. Well, I think we have expectations about clients' behaviors, don't we, based on the impressions we have on them, if they're Latinas, and, a lot of the stereotypes about Latinas may not fit then how someone presents in counseling, like you did, being assertive about this. How is this issue of assertiveness for you in the workplace?
Well, it's something that I had to learn to deal with very soon. In the workplace in the United States is very different from what I'm used to at work, or even in a family situation. You are not supposed to bring up issues so directly. You first try to do it by other means. I had to learn, if I knew that if I wanted to succeed, I needed to be more direct and talk about my feelings more often and feel more secure about them. And it is not something that comes naturally, but I drill myself, and I do it every time I can.
Thank you. Dr. Mann, Gloria talked about her being different, her sense of being different, and that there is some difference in terms of talking with an accent and looking different. How do you see that in her work situation as a counselor looking in on and hearing her story? How do you think those factors are in some way putting up a barrier between her and her boss?
I think that in terms of the work environment and her boss, I'm not. This is where I would feel at a disadvantage. Is that, I might be. In my head, I can understand that, and but I can't sort of get a sense of, especially how it would feel. But certainly, if that's that's how it feels for Gloria, and you have to respect that. And certainly, common sense dictates that that's probably how it is. And my experience in the workplace has been, that you have a pool of Caucasian workers and Afro-American workers, and Hispanics, and they're sort of the middle group, kind of like the middle child. They're sort of in between and not quite here and not quite there. And I would have to wonder about your boss, and if that's the base from which he would be operating too.
Thank you. And I think that's really the point we wanted to bring up. There are 2 points you've made, Dr. Mann, that seem very important to this. One is that sometimes for a therapist who's working with a client who's culturally different, and in this case Latina, who's never had a difficulty communicating in English because you don't have an accent or you were born here and there's more cultural similarity than dissimilarity, it might be hard to relate to that. But you're saying you have to accept the client's experience and how she reports it. And second is that the environment in which one finds oneself working does in fact contribute to feeling included and excluded. And you commented about your sense of exclusion there.
Yes, I feel extremely excluded in the work setting. I feel that I don't have anyone to go to. Whenever I go and ask my fellow workers about the situation, they just don't feel to get it either. They just feel that everything is fine and that I shouldn't be worrying about this situation. And there is where I start to doubt myself and feel that there's something that it's either wrong with me or the situation at work is not the best for me.
Let's stop now because we want to go on to the learning points for this particular video. What Dr. Mann raised for us a few minutes ago is the whole issue of how one's sense of belonging in an environment that's unfamiliar needs to be heard in its reality for the particular client as she's reporting it, even though as a counselor we may never have experienced that sense of difference or disconnection. How the client presents that is very real to her. Gloria, the client, also raised for us some of the issues of feeling invisible in an environment that is different for her from a cultural, ethnic, and even a linguistic point of view. I'd like to just highlight a couple other things that we really didn't have adequate time to process. One is the issue of being bilingual, and how being bilingual is really a strength, but often in many work environments, an employee who speaks Spanish is often faced with many work requests and does comply, but never receives any particular recognition or appreciation for that. A second point I'd like to highlight is also the sense of loyalty that Latinos bring to not only their families, but how that carries over to the workplace. And I heard Gloria having some conflict about that as well. Again, doubting herself, but also feeling as though Hank was really giving her some good advice, although here we heard she was starting to doubt that. I think the third issue that Dr. Mann also brought up for us was that about the invisibility of Latinos in the workplace, and perhaps how some managers only look in terms of the reference as being white employees or black employees, and somehow don't have enough information or enough understanding about how Latinos fit into this formula. This is vignette number 4, and it features Dr. Mann with the mother and her teenage daughter. The participants in this role play are Mercedes, the mother, and Milagros, the teenage daughter, who you will hear wants to be called Millie. Let me tell you a little bit about this particular family. Mercedes has been a single mother for 10 years, raising her son Jaime and her daughter Milagros. Mother and daughter have been engaged in many struggles recently about each other's wishes regarding Milagros' friends, her future education, she wants to go away to college, and their relationship to one another. Mercedes wants to raise her daughter like she was raised back in Puerto Rico. So let's hear the issues that come up for mother and daughter. Not only are they issues of family, they're issues about acculturation, as well as the wish on each part, mother and daughter, to maintain a relationship, but in a different way.
Hi, I'm Dr. Mann.
Very nice to meet you. I'm Mercedes.
Hello, Mercedes. How are you? I'm Dr. Mann. You are?
Millie?
Hi, Millie.
Milagros.
Millie?
We seem to have a little
Yeah.
confusion here.
Well, her name is Milagros.
Her like official name?
Yes,
Yes.
that's her name.
And how do you want to be
Millie.
called? This is, I see. And
Okay.
how do your friends call you?
Millie.
Millie?
Yeah, so it's Millie.
Is this sort of kind of what brought you here?
Well, I don't think that's what brought us here, or this could be something that we can talk about later on. We have been having a lot of trouble lately, and it just doesn't, I think that Milagros doesn't get that who she is and where she, the family that she was brought up at, and she's getting too Americanized, and I'm not sure whether I can deal with that anymore. I have tried to talk to her about the issue, but she doesn't seem to be able to listen.
I see. Just, I want to hear from you in about 2 seconds, okay, Millie?
fine, yeah.
But before that, is it okay? I'd like to ask you and your mom a question. And I'm just wondering, obviously I'm not a Latina counselor. I don't speak Spanish. I can read a dib here and there, but I'm wondering if where you are with that. I don't know quite exactly what you were expecting when you made the appointment.
Well, I would have preferred definitely to have a Latina or a Latino, but it's very difficult to get one. I'm not sure whether this is going to work. Just because I think that a Latino person would have been able to understand me better and understand the family issues that are involved. I'm not sure, but I'm willing to try.
Okay. And
I don't care. I mean, it was her idea to come here in the first place, so I don't care if you're Latina or not. I don't care. It's no big deal to me.
doesn't matter.
No.
Okay. Now, your mom told me a little bit about what's going on in the family. Would you? What from your side? How does it look?
My side?
Yeah.
Oh, you heard her. She just goes on and on. She just goes on and on. I mean,
no respect.
Okay,
We have
okay. Let's
respect.
just have one person at a time talking, okay? Now, can you just sort of give me a thumbnail sketch?
okay, she says there's no respect in the house, but she gives me no respect either. I mean, she says, oh, listen to me, listen to me. She's always talking. She always says, listen to me, you know, but she doesn't respect what I have to say. She doesn't respect what when I want to talk. She doesn't listen to me either. I mean, she listens to Jaime all the time.
And who's Jaime?
My brother.
My son.
Your son? And
He's away at college now.
he's away.
Yeah.
Uh-huh. And what year is Jaime?
He's in his freshman year.
He's a freshman.
Yes.
And you're
But the problem is that she wants to go away too, and I don't think that's acceptable in our family. That would never happen. She should feel lucky that I want her to go to college. I think she should go to a community school around town and do a 2-year secretarial.
Look, listen to this, okay? She wants me to go to secretarial school.
I never went to college, but I mean, I think that you should go, but I don't want you out there. I don't know what's out there
She
and
thinks-
what
I mean, I
can
don't know,
happen
she-
to you.
First of-
You need to be close to me. I
Well,
need
I'm
to
almost
protect
18
you.
years old.
okay.
I know, you're
Let's hear
just
Millie.
18.
Let's hear from Millie for a second.
Okay, first of all, I'm almost 18 years old. Yet she still treats me like I'm 5 years old. I mean, my brother can go away to school, okay, but I have to stay near the house, near home, etc. And she thinks that by leaving the house, I'm abandoning my family. I'm not. I just want to be able to. All my friends are doing it.
All your friends are going away?
All my friends are going away to school, and I mean, I want to be able to know how it is to live on my own. She did it. She came all the way from Puerto Rico on her own.
Oh, she did?
Yeah.
So, let me just see if I get this. It's okay for Jaime to be wherever he is. Where is he, by the way? On the coast or somewhere? Oh, he's in Amherst? Okay, so he can be in Amherst, but if Millie wants to go away, that's either not okay or not acceptable, or both?
Jaime is a male. He was brought up to leave the house, to leave the home soon enough in his life. He knows how to deal with problems. I raised him to be able to go out and deal with the problems. She is a female. She doesn't, I mean, she needs my protection. She needs to be close to me.
Let me ask you a question that Millie also asked you, but I'm not quite sure what the answer was. And it had something, didn't you make some sort of comment to Mom about that she came from Puerto Rico to here by herself?
She came here to the States.
Is that?
That is true, but those are very different circumstances. I had to come here to look for a job, and believe me, it wasn't easy. It was very hard,
yeah, I'm
very
sure it
hard
was.
to get here by myself with 2 young children and have to deal with a completely different culture and deal with so many new things that I wasn't used to. I don't want Milagros to go through this. I think that she needs to get, you know, she can go to school. If she can go to school close by, she will be able to have whatever she wants, but I will be there, and I will be there to help her and support her.
If Millie goes away to school, that her college experience is going to be similar to when you came here from Puerto Rico.
Yes, and there are so many different, so many dangers out there, you know.
Can we just hear from Millie and what she thinks about that?
I mean, I do think that she knows that she did a good job raising me. I mean, I know, I do respect her. I know she came here, she worked hard, she raised me and my brother, okay? And I know you did a lot, okay? But there's more out there, and
Let's now begin the debriefing of vignette number 4. What we saw was not a very unusual situation as you would within a Latino family. A mother and a daughter engaged in some struggles because each wants to be connected, but each also wants to be her own person, especially Milagros. I'd like to talk to the participants about the role that they played, but also about the issues that they saw from their respective roles. Dr. Mann, could you begin by telling us what you saw as the issues a non-Latino counselor might have missed with respect to Mercedes' wish to really have her daughter be there with her?
Yeah. That a non-Latina counselor would have missed, which is just what you were saying in terms of sort of wanting to maintain the togetherness, but still allowing some growth, sort of go but don't go, kind of a tug of war, which is, sort of different from. Actually, it's quite different from what I learned and the way I was trained in terms of, separation is the be-all and end-all, and you just got to do it and bite the bullet and blah, 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 blah. So,
the rule about self-determination is very strong in our counseling models.
yeah, definitely, and it would be easy to fall into that with mom and with daughter. That's not the model that they're coming from, and it's not the model that they're both struggling with.
And one of the things that we, of course, didn't allow with the time was to have a fuller discussion. And just to make an observation, Mercedes, in a way, Dr. Mann stepped into one pitfall, though, which was about giving more time or giving equal time. Or she said she was going to give equal time to Millie. How did you take that?
Oh, it was hard, very difficult.
Did you find it offensive?
Yes, it is offensive. I think that the way Latinos bring up their children is that they are supposed to look up to their parents, and one way of manifesting that is to perhaps not talk until they are they feel that they can talk, and that is not a difficult thing to learn in a Latino family. You make sure as a kid that you don't talk until your parents allow you, or that you feel that they have finished their thoughts. And here I am in the presence of a person that is giving my daughter equal time, and that is not acceptable.
So in a way, it's a breach of what we call respeto.
Right.
And respect is, again, very defined in Latino culture based on your role and hierarchy as well, in this case in the family. Milagros, you talked about the wish to be your own person, and yet your mother's wanting you to stay at home, not go to college, away from home. And can you talk about your bicultural experiences?
I think one of the hardest things I was trying to express in fact was that you're kind of caught in the middle. I do respect the Latino culture. I do respect being close to your family. I try to stress that I wasn't going to abandon my family. But at the same time, she doesn't understand that in the United States, you are expected to go to college. And that's really important. So it was very difficult for me to express to her how American culture, what the expectations at my high school are. That, you do go away to college. You don't stay at home. And people who stay at home aren't, you're not achieving.
So there are different norms that you have at school and norms at home, of course, from the culture, very strong messages. We also heard the double standards about how you're raising your son, and we would call them double standards, and then how you want Millie to be, or Milagros. Do these double standards typically operate in Latino families?
I think they do, in a way. It's changing, but I think that up to now is the male, is the son that goes out and gets the college education for many reasons. Basically because it is the male who is supposed to be the only provider of the economic provider of the house, and the female is supposed to stay home raising the children. So it's not like the woman is supposed to go out and get a college education. She's supposed to stay close to home, do perhaps some college because she would have better opportunities to get perhaps a job while she is not married, or maybe to help support the family later on, but nothing serious as a son or the male son will have to.
So the expectation would be that she would stay at home until...
I think it's really important, I think, for the Latina woman to be the mother, to be a family. So that's a very priority. They look upon you as like, you don't want to have a family. That should be your first priority. A career woman isn't something that's seen upon favorably.
It's not valued in the culture.
Yeah.
The role of mother is highly valued in Latino culture. Dr. Mann, are there any cultural issues that you were wondering about and were not so sure of as we had this role play go on? Anything that you were curious and didn't have a chance to explore?
Well, the whole the difference in how separation is viewed in as desirable or undesirable, or however you want to frame it, and who has what expectations around that. But then I had another question too, in terms of like the value of motherhood, and motherhood is, it's sort of like
very sacred.
Thank you. Yeah, very sacred. So then, if the daughter goes off to college, what happens to the mom's role, and does that mean a loss of respect, a loss of position?
It might mean a loss of esteem.
Yeah.
Certainly it might mean a loss of esteem. What you're raising are some very important questions and observations, and if this counseling relationship were to continue, these would be some of the issues that would be raised and discussed, perhaps separately with mom, not in front of daughter either, because that becomes more personal. And then you would also want to see how daughter could understand what that would mean to mom if she were to go off to school, if you gave her permission to go off to school. Let's make sure we understand some of the main points, learning points for this particular vignette. One is that in Latino culture, daughters are an extension of their mothers. We talked in some of the earlier role plays about how women are socialized to be not only caretakers, but how daughters are expected to be their mother's right-hand person. We also heard the double binds that present for both the mother and the daughter. Certainly the double binds for the daughter about bringing up, being raised rather, in a bicultural environment. And that there is greater protection of young women in Latino culture. The norms are different for men and women. Acculturation impacts families of different generations, and we heard the acculturation differences between mother and daughter. Clearly, the emphasis on the anglicized name that Millie wanted to have is a point that I think many of us can relate to if we have been counseling in bilingual, bicultural situations. And I think the last point that Dr. Mann underscored a couple of times is this issue of separation versus individuation. One that in Latino culture really does not have any standing. In fact, it's very countercultural to want to move away. And again, that does not in any way suggest enmeshment as it has often been characterized, but more it's a statement about the value of interdependence as well as loyalty to the family. The 4 vignettes you saw in this videotape are just a few examples of a number of issues that might arise in counseling with Latinos. The main issues we covered in these 4 vignettes were relationships, issues of authority, the family came out very strongly, and gender roles. We also heard through these the sense of commitment and loyalty individuals have to their families. From the role of the therapist, we heard some of the issues that they could more easily relate to because they were of the same culture, other issues that one could relate to because of good counseling skills, being good active listeners, being very perceptive about the dynamics that were going on between mother and daughter and between the couple, Sophia and Raul. But at the same time, as Dr. Mann pointed out, there were some issues that because of our counseling upbringing, if you would, the culture of counseling, that might be different and new to a counselor who's not culturally aware of Latino values. So I hope you have found this tape to be useful to your own learning experience, that you will make a real commitment to learn as much as you can about counseling with Latinos. This tape is just one tool for that. And we hope to hear from you about other ideas you may have for tapes that might be useful to your continued education and development. Thank you for being with us, y buenas noches.